The initial rapid assessment must determine the magnitude of the disaster or emergency in progress. It details the health status and needs of the displaced or refugee population and permits an appropriate operational response. To carry out the initial assessment, certain essential data must be gathered very quickly, often in less than a week.
Probably less than 125, but we have to ask the people to measure.
In particular, this includes demographics, health, nutrition, immunization coverage, access to healthcare, and basic necessities such as water, sanitation, and shelter. Monitoring any deaths in the population is a top priority. The initial assessment among the population gives a quick overview, accurate enough to tailor often large-scale relief operations. Remember that a simple analysis, frequently based on common sense, is expected at every step. During an emergency situation, the initial diagnosis relies on several types of data, sources, and methods. The population can be estimated in a day using, among others, rapid techniques such as mapping. This provides the denominator needed for activity planning. These data will be validated later with more accurate censuses.
Many deaths in August. Okay, right. Okay, so if the branch is new, then it's someone who just died a few days ago, which did not happen. Okay.
For example, this one.
The mortality rate, which reflects the severity of the situation, is the first health indicator to be documented. This is done with a population survey. After that, the mortality data should be monitored daily via a simple surveillance system for deaths, using community health workers.
Who sleep here?
9.
9, okay. How many small children? This one?
Surveys using samples of the population provide information on family composition and the percentage of children under 5 years who are more vulnerable. They also give information on any deaths and basic water, shelter, hygiene and sanitation needs.
When they arrived, did they take the weight of the children or the MUAC?
The measles immunization coverage and prevalence of malnutrition can also be assessed during these surveys.
You have to visit them to know about the situation.
Depending on the context, a limited number of other questions will be added, such as whether people have a registration card and about any violence to which they have been subjected.
Today? But tomorrow she can go to the hospital?
Yeah. Okay. With her.
Which water did they took?
An epidemic alert and surveillance system for killer diseases is essential, especially for acute diarrhea, respiratory infections, malaria and measles. The data are obtained from treatment registers from MSF or other operators.
Les cas en rouge ont été confirmés et à leur semaine 45, ça se diffuse beaucoup plus.
If necessary, specific epidemiological investigations should be conducted. The data provided by humanitarian aid distribution systems should be consulted and cross-checked with other sources. Data from general distributions of food and household kits such as buckets, mosquito nets and soap can also be useful for getting a general picture of the families being helped. While we measure the effectiveness of the operation by monitoring mortality and morbidity, the population must have access to appropriate emergency medical and surgical care, including the necessary drugs and supplies.
Is there another caregiver with this woman?
There should also be a specialized program to verify the nutritional coverage of children with severe acute malnutrition, and in some cases, adults during major food crises. Efficient operations require significant resources in a very short time frame. It's necessary to verify the availability of general resources sufficient for emergency operations. This means human, financial and logistical resources with appropriate transport, not to mention water, hygiene and sanitation.
To the entrance of the registration point. This way, if people come, we can vaccinate them directly. We could screen
Coordination between relief operators is essential, especially during large-scale operations with mass population displacement.
The main point was to try to secure the water during the day.
Security issues are always a priority, both for the population and for aid workers.
So good, thank you.
See you later.
Okay, thank you.
Information from the initial assessment can be used to inform about the health status of the population, to target the emergency operations to be conducted, and to better plan them with the resources needed. Everything should be interpreted taking into account the local, social, political, security, geographic and climatic context, which requires that the operators have knowledge about the site where the population has taken refuge. The information can also be used to speak out about the situation of the refugees or IDPs.